In today's medical rounds, if you experience sudden, severe chest or upper back pain that radiates to the neck or down your back and experiencing shortness of breath, you might be at risk for an aortic dissection. And here to talk more about aortic dissections and what to do if you have these symptoms that could be related is Dr. Akhilesh Jain, the Chief of Vascular and Endovascular Surgery at Hartford Healthcare's Heart and Vascular Institute. Thank you so much for being with us, Doctor.
It's my pleasure to be here. Thank you.
It's very important because this is serious. So what is an aortic dissection and what can cause it?
So when we look at the aorta, this is the main artery coming out of the heart and supplies the blood to the entire body. The artery is about the diameter of a garden hose. However, unlike a garden hose, the wall of the aorta is made up of multiple layers, something like onion peel. So when the layers of this aortic wall separate from each other and split open, we call it aortic dissection. This is a life-threatening emergency requiring immediate medical attention. Some risk factors include high blood pressure, which is uncontrolled, plaque deposition, something like atherosclerosis, or history of aortic aneurysms. There are people with connective tissue disorders who are also at a higher risk of aortic dissection, such as patients with Marfan syndrome. We do see some familial predisposition to the aortic dissections.
Okay, and so how do you know if you're actually experiencing this, and what do you do if you think you could be?
So 80 to 90% of the patients with acute aortic dissection experience sudden onset of severe chest or back pain. They usually describe it as a severe sharp pain or a tearing pain that kind of goes from the front of the back of rib cage and may even go down to the belly. Other people may experience sudden onset of pain in the stomach or paralysis, and sometimes symptoms like a heart attack or a stroke. So those are all the potential symptoms of aortic dissection.
Okay, we have a little less than a minute, but if you do undergo aortic dissection surgery, what can you expect after?
So you want to call 911 and get to the ER right away. Emergent blood pressure control is paramount important. Patients get a CT scan, and then depending on where the dissection is and how the other things, patients may require open heart surgery or something minimally invasive like a stent graft. And this is always best managed at a place with a multidisciplinary expert approach, something like we have at Hartford Hospital.
Yeah, you want to make sure you're managing your heart on your good health on top of it. But thank you. It's definitely something you want people to be aware of so they can call 911. So important. Thank you, doctor.
You're very welcome. Have a great day.
You too. For more information on today's segment, you can head right to our Channel 3 app, and we will link you also to the Hartford Healthcare website so you can get some more information.